Our next guest is Lisa Smith, Novant Health Brunswick Medical Center's Emergency Department Manager. Welcome, Lisa. It's a pleasure to have you.
Thank you. It's great to be here.
Good. First, I want to start by learning a little bit about you. So tell our viewers a little bit about your background.
Well, I moved here 11 years ago from High Point, North Carolina. I have an associate degree in paralegal work. I worked in the law for 15 years.
Well, that's interesting.
And then became a nurse. So I have lived here for a little over 11 years.
Wow. Tell me about your role at the hospital. What is it that you do?
I am the emergency services nurse manager, and I am responsible for the organizational process of the department. That also entails being an advocate for the patients, the families, and also for the staff. I get to participate in watching the staff grow professionally and personally.
Yeah, that's nice. How long have you had the role of emergency department manager?
I was interim manager, made interim manager August of 2016, and then became the permanent manager November 2016.
Well, I know that the emergency department is very busy. That's just one of the busiest departments in the whole hospital. But what would you say is the most common issue that you see in the emergency department at Novant Health Brunswick Medical Center?
We see a well-balanced group of people from the community, I think, and also the people who are traveling here. We have big travel industry here.
Yeah, we do.
So we see a lot of respiratory, we see a lot of gastroenterological issues. We also have continued to see a growing amount of stroke patients, and we have an excellent stroke process.
Well, I suspect that there are different things, that you see more of certain things in the summer versus the winter. Talk to me a little bit about that.
Yeah, in the winter we see, this time of year we see a lot of the respiratory and a lot of the flu. So I would just remind our community to make sure that they wash their hands to keep from spreading it. Cover their cough, and also if they do come into the hospital, to wear a mask. It's not only for their protection, also for others' protection. And during the summertime, we see jellyfish and stingray injuries. We also see quite a few lacerations from oyster shells.
Oh yeah, those are sharp.
We also have an occasional shark bite.
Yeah, that's true.
And then we see, we do unfortunately see some near drownings and drownings.
Yeah. And those are sad times. I know that oftentimes when you go to the emergency department, you're not sure what to expect. So talk to me a little bit about the process and what patients might expect upon entry to the emergency room.
When they first come into the department, they will be greeted by our registration personnel and also by guest services, and they will get them registered for their visit. And then if we have rooms in the back, they will be taken straight back to be treated. If we do not have rooms in the back, then they will go through a triage process with a nurse out front. Once they get in the back, they will be seen by a nurse and by a provider, and then any of our ancillary departments that their condition requires, like radiology, lab, those different ancillary departments.
I know that oftentimes there are long waits in the emergency department, and sometimes it's just out of control, there are too many patients or what have you. But how do you prioritize which patients get seen first?
We prioritize by the severity of the condition, and obviously whoever we feel like needs to be seen first that's more critical is who we will take back first. It's not necessarily on a first come, first served basis.
And I think sometimes folks think that's how it should be or is, and are discouraged when they see somebody go ahead of them.
Right. We have 22 rooms in the emergency department, 2 of those being trauma bays. We have 11 rooms where we see our higher acuity patients, and then we have a fast track side where we see patients with the lacerations and the breaks and those kinds of things. So they will go back to that care station 1 side based on the severity of their condition. However, sometimes patients will get taken back to that care station 2 side because they are in and out quicker than on the other side. We have reduced our doctor to patient time, or our door to patient time, from 23 minutes this year down to 9 minutes.
Wow, that's quite a drop.
So we have had more providers over this last 6 to 8 months.
Well, this has been really helpful for me. Is there anything else that you would like to add before we close today?
I would just like to say that through our service standards, the know me, respect me, delight me, and care about me, our emergency department provides excellent care.
Thank you so much for being here today. It's been a pleasure to have you, and welcome to the emergency department, your new role in the emergency department. So we appreciate you coming.
Thank you.